welcome Dr. Salin to the right of the bush. Are you ready for your interview?
I think so.
Why are you an orthopedic surgeon and what brought you to this career?
So I chose orthopedics just because of when we do things, we help quality of life. I would say more so than quantity of life. This specialty I chose was hip and knee replacement, and I do think that when patients come to see us and they're in significant amount of pain and discomfort, the ability to take that patient, do a surgery, and affect significantly their quality of life to where now they can participate in activities that they want to do is very rewarding. I had the opportunity as a undergraduate student to work in an emergency room, and I was working with a plastic surgeon in the ER, repairing a face, and we were talking about things, and one thing he told me, he said, whatever you decide to do it realizing that at some point you will do it for free. And if you enjoy that job that much, then that's what I'd tell you to go into. And so we all know that sometimes things don't get paid, bills don't get paid, and you do things for free. Sometimes you put in overtime in a job that you're really not getting paid for. And so if you enjoy that job that much, it's very rewarding just to be able to do it.
So you have a bearded friend and a non-bearded friend. What do you utilize your mid-levels for?
So my bearded and non-bearded friends, my nurse practitioner and PA, I utilize them pretty much for everything. So they go with me to all my surgeries. They are critical and crucial in helping me with surgeries. The surgeries that I perform are very physical. Working on hip and knee, those are large joints, and to manipulate those joints around, to be able to accurately reproduce a surgery every single time, you need experienced assistants to be there with you 100% of the time. They know the procedure backwards and forwards, they know the role that they play in it, and it's very critical. They also allow me to help more patients by seeing extra patients in the office that necessarily don't need to see me, but can be treated by them with their great knowledge and expertise in what we do.
What is your favorite surgery to perform?
I would say total hip arthroplasty or total hip replacement is probably my favorite procedure to perform, simply because it goes back to what I initially said. The quality of life is so much better. The downtime after a total hip replacement, the pain experienced after a total replacement is so much less than a total knee replacement that patients typically are more satisfied earlier on with a total hip than they are a total knee.
What are some of your favorite hobbies outside of work?
So I recently got into high altitude climbing. My family and I climbed a mountain in Peru. We went to about 17,000 feet. And since then, I've fallen in love with the mountains. We've been to a couple 14ers, which are the highest peaks in the continental United States, are 14,000 feet. The highest one being in California, Mount Whitney. The second is in Colorado. So we're fortunate enough being here in Kansas to have not a far flight or drive to the Colorado mountains and climb all the 14ers there. So my wife and I have been spending a lot of time in Colorado climbing those. In fact, today we were supposed to be leaving to go climb Kilimanjaro, but with the wonderful virus that we have, that was canceled or postponed until next year.
Care to give us an example?
So this is what I have been using to kind of prepare us, since here in Kansas we don't get to climb very much. It's kind of fun to put on and pretend like you're Darth Vader. These little knobs will set us at different altitudes. So this is set at 18,000 feet to try to reproduce that and increase what's called your VO2 max as far as how your muscles will metabolize oxygen at lower levels. And so sounds kind of like Darth Vader when you put it on and exercise, but I thought about wearing this for my COVID mask, but it wouldn't work very well.
What is a personal fun fact that you can share with us?
my personal fun fact. I speak Japanese, so I spent 2 years as a missionary in Japan, and so when I was over there, became fluent in speech, and learned 2 out of their 3 alphabets. Did not master kanji, which is the Chinese characters. Other fun facts. Oh, yeah, I from the background back there reminded me that I do enjoy lighting off fireworks, legally, of course.
So the patients and the staff are dying to know, how do you get your hair slicked back?
So, secret to that is a lot of hair product called Got to Be Glued.
And then patients will hear you running around saying ho-ho with a 4-0. What does that mean and where does it come from?
So ho-ho with a 4-0, when we inject knees or most of the joints that I inject, we use 40 milligrams of Kinalog, which is a steroid. And so it's just saying that ho-ho with a 4-0. Easy to say, comes out, rolls off the tongue.
And lastly, is there anything that you'd like to share with your patients today?
You know, it's interesting times that we live in with the virus and whatnot. Sometimes it's hard to be optimistic. You know, that's the one thing that I think is really crucial, especially as you undergo surgeries, as you live life, as you hit hurdles in life, whether that be arthritis, whether that be a nasty pandemic, just to keep your head up and be optimistic. Surround yourself with optimistic people, surround yourself with good people. And that's the only thing I'd share with you, whether it's surgery, whether it's pandemic, whether it's life, whether it's cancer, be optimistic.
Well, thank you for sitting with us, Dr. Salin. Now, get back and see your patients.